एवरीवन, वेलकम माय यूट्यूब चैनल। मैं टॉप 100 एनाटॉमी एंड फिजियोलॉजी का क्वेश्चन लेके आई हूँ एंड उसमें से 5 क्वेश्चन तो एकदम कॉमन आएगा। तो चलो स्टार्ट करते हैं क्वेश्चन नंबर 1 से। तो क्वेश्चन नंबर 1 इज विच इलेक्ट्रोलाइट इम्बैलेंस इज कॉमन इन रेनल फेलियर। Here correct option is option A, hyperkalemia, that means increase in potassium level. Number 2 is which drug is avoided in penicillin allergy. Here correct option is option B, cephalosporin. Number 3, which hormone regulate calcium in blood. Here correct option is option C, parathyroid hormone. 4 is which sound is heard first during blood pressure check. Here correct option is option A, Korotkoff phase 1. Number 5 is which test confirm HIV infection. Here correct option is ELISA test, ELISA. Question number 6 is which vitamin prevent neural tube defect. Here correct option is option B, folic acid. Question number 7, which IV fluid is best for dehydration with vomiting. Here correct option is option C, RL, that means ringal lactate. Question number 8 is which sign indicate fluid overloaded. Here correct option is option C, crackles in lungs. Number 9, which vaccine is given at 9 months in India. Here correct option is option C, MMR, that means measles, mumps and rubella. Question number 10 is which blood group is universal recipient. Here correct option is option C, AB positive. Question number 11, which route is fastest for drug absorption. Here correct option is option C, IV route, that means intravenous. Question number 12, which method is best to break chain of infections. Here correct option is option A, hand washing. Question number 13, which type of immunity is given by vaccines. Here correct option is option B, active artificial immunity. Number 14, which position is best for shock. Here correct option is option D, Trendelenburg position. Question number 15, which gland control metabolic rate. Here correct option is option C, thyroid gland. Question number 16, which disease is prevented by BCG. Here correct option is option C, tuberculosis. Question number 17, which symptom is seen in hypoglycemia. Here correct option is option A, sweating. Question number 18, which organ makes bile. Here correct option is option C, that is liver. Question number 19, which condition need iron supplement. Here correct option is option C, anemia. Question number 20, which site is safest for IM injection in infant. Here correct option is option C, vastus lateralis. Question number 21, which gland control growth in the body. Here correct option is option A, pituitary gland. Question number 22, which vaccine prevent hepatitis B. Here correct option is option C, hepatitis B vaccines. Question number 23, which hormone increases blood sugar. Here correct option is option B, glucagon hormone. Number 24, which condition uses N95 mask. Here correct option is option D, tuberculosis. Question number 25, which position prevent aspiration in unconscious patient. Here correct option is option D, lateral. Number 26, which sign shows dehydration first. Here correct option is option C, rapid pulse. Question number 27. Which test check kidney function? Here correct option is option C, creatinine test. Question number 28. Which hormone control blood pressure by sodium retention? Here correct option is option C, aldosterone. Question number 29. Which vitamin help iron absorption? Here correct option is option B, vitamin C. Question number 30. Which injection prevent tetanus? Here correct option is option B, TT, that means tetanus toxoid. Question number 31. Which food is high in potassium? Here correct option is option C, banana. Question number 32. Which sign indicate left-sided heart failure? Here correct option is option B, crackles in lungs. Question number 33. Which precaution for COVID-19? Here correct option is option B, droplet and airborne. Question number 34. Which condition is prevented by folic acid? Here correct option is option B, neural tube defects. Question number 35. Which lab test confirm pregnancy? Here correct option is option C, SCG. Question number 36. Which electrolyte affects heart rhythm most? Here correct option is option C, potassium. Question number 37. Which device prevent deep vein thrombosis? Here correct option is option B, elastic stockings. Question number 38. Which site is best for insulin injection? Here correct option is option B, abdomen. Question number 39. Which test detect TB exposure? Here correct option is option B, Mantoux test. Question number 40. Which nutrient help wound healing? Here correct option is option B, vitamin C. Question number 41. Which sound is heard in asthma? Here correct option is option C, wheezing. Question number 42. Which organ store vitamin B12? Here correct option is option C, liver. Question number 43. Which symptom shows anemia? Here correct option is option B, pallor. Question number 44. Which signs show hypovolemia? Here correct option is option C, weak 3D pulse. Question number 45. Which nutrient prevent night blindness? Here correct option is option C, vitamin A. Question number 46. Which drug can cause GI bleeding? Here correct option is option C, ibuprofen. Question number 47. Which site is best for heparin injection? Here correct option is option C, abdomen. Question number 48. Which PPE is removed first? Here correct option is option C, gloves. Question number 49. Which hormone help milk ejection? Here correct option is option C, oxytocin hormone. Question number 50. Which test check long-term diabetes control? Here correct option is option G, HbA1c. Question number 51. Which infection need reverse isolation? Here correct option is option A, HIV or AIDS. Question number 52. Which sign is typical in meningitis? এই কোশ্চেনের অ্যান্সারটি আপনারা নিজে থেকে দেওয়ার চেষ্টা করুন। 52 নম্বর কোশ্চেনের অ্যান্সার আপনারা কমেন্ট বক্সে কমেন্ট করুন, ঠিক আছে? এবার নেক্সট কোশ্চেন 54. Which sign indicate hypoxia? Here correct option is option B, restlessness. 55. Which measure prevents bed sores? Here correct option is option B, frequent turning. Question number 56. Which gland releases insulin? Here correct option is option B, pancreas. 57. Which position is used for spinal anesthesia? Here correct option is option C, knee chest lateral. Question number 58. Which signs show increased ICP? That means intracranial pressure. Here correct option is option A, bradycardia. Question number 59. Which hormone regulate water balance? এটি অনেক ইম্পর্টেন্ট কোশ্চেন। Here right option is option B, ADH. Question number 60. Which food to limit in hypertension? Here correct option is option C, salted snacks. Question number 61. Which vitamin help clotting? Here correct option is option D, vitamin K. Question number 62. Which vein is used for central line? Here correct option is option C, jugular vein. Question number 63. Which signs show hypothermia? Here correct option is option B, severing. Question number 64. Which hormone lowers blood sugar? Here correct option is option B, insulin. Question number 65. Which PPE prevent airborne infection? Here correct option is option D, N95 receptor. Question number 66. Which site is best for IM injection in adults? Here correct option is option B, deltoid. Question number 67. Which precaution prevent spread of TB? Here correct option is option C, airborne. Question number 68. Which IV fluid is isotonic? Here correct option is option C, NS, that means normal saline. Question number 69. Which test check protein in urine? Here correct option is option C, albumin test. Number 71. Which hormone help uterine contraction? Here correct option is option B, oxytocin. Number 72. Which organ remove old RBCs? Here correct option is option C, spleen. Question number 73. Which drug treat anaphylaxis? Here correct option is option C, adrenaline. Question number 74. Which nutrient is most needed in pregnancy? Here correct option is option C, folic acid. Question number 75. Which vitamin prevent rickets? Here correct option is option C, vitamin D. Question number 76. Which injection site to avoid in infants? Here correct option is option A, gluteus. Number 77. Which organ produce erythropoietin? Here correct option is option B, kidney. Question number 78. Which signs show respiratory distress? Here correct option is option B, nasal flaring. Question number 79. Which fluid is best for hypovolemic shock? Here correct option is option C, RL, that means Ringal lactate. Question number 80. Which PPE remove last? Here correct option is option A, mask. Question number 81. Which organ store glycogen? Here correct option is option C, liver. Question number 82. Which sound is normal lung sound? Here correct option is option C, vesicular. Question number 83. Which population for chickenpox? Which precaution for chickenpox? Here correct option is option D, airborne. Question number 84. Which site is used for IV cannula? Here correct option is option B, arm vein. Question number 85. Which sign indicate fluid deficit? Here correct option is option C, weak rapid pulse. Question number 86. Which hormone control urine output? Here correct option is option C, ADH. Question number 87. Which food is best for iron? Here correct option is option C, spinach. Question number 88. Which sign shows infection? Here correct option is option A, redness. Question number 89. Which sign indicate meningitis? Here correct option is option B, neck stiffness. Question number 90. Which hormone is from adrenal medulla? Here correct option is option C, adrenaline. Question number 91. Which vaccine prevent polio? Here correct option is option C, OPV. That means oral polio vaccine. Question number 92. Which site is best to check capillary refill? Here correct option is option B, nail bed. Question number 93. Which signs show hypokalemia? Here correct option is option A, bradycardia. Question number 94. Which test is done for syphilis? Here correct option is option C, RPR. Question number 95. Which site is best for IM injection in children? Here correct option is option B, vastus lateralis. Question number 96. Which diet is good for diabetes? Here correct option is option B, low carb. That means carbohydrate, low carbohydrate. Question number 97. Which solution treat hyponatremia? Here correct option is option C, NH, that means normal saline. Question number 98. Which sign shows cyanosis? Here correct option is option B, blue lips. Question number 99. Which test check jaundice? Here correct option is option C, bilirubin test. Question number 100, and this is the last question. Which hormone is secreted by pancreas? Here correct option is option C, insulin.